why is bacteria up in our water lines a problem? And you can go to the next slide. I always like to kind of paint a picture of the why. So I think that, if you see a human face and it really humanize the why, it really makes a difference. So this is Mimi Morales, and she is one of the faces of the why behind waterline maintenance. She's just one of many who were infected in the Anaheim outbreak a few years back. She's a 7-year-old little girl who got a routine pulpotomy. She developed a severe infection in her mouth. She had to have part of her jawbone removed, had to have permanent teeth removed, and she received heavy doses of antibiotics. And guys, we're not talking about just amoxicillin or penicillin, which they tried. I'm sure they tried. But we're also talking, we're finally what worked for her and for several other children was the antibiotic that was created to treat leprosy. So that in itself just came with terrible side effects. So not only does she lose part of her jawbone, permanent teeth, but she has like hearing loss and horrible side effects from the cure. So
kidney damage too.
Yeah, so many problems. Yes. So this sweet little face, this is the why. This is why we do what we do. And it was all because of contaminated dental unit water lines. So yes, this is the why. You could go to the next slide.
And here's the timeline of how this worked. It's kind of interesting. Mimi was one of the first children to show up at the Orange County emergency room at Orange County Hospital. But a couple weeks later, another child showed up with similar symptoms, and the doctor that was on call, by some kind of miracle, happened to be a pediatric infectious disease expert. And like Kelley said, she tried all the normal antibiotics and finally had to reach out to the CDC for help. But when a second kid showed up, they asked if they'd been to the dentist, and they didn't necessarily say yes, because the incubation time on this particular Mycobacterium abscessus is what it's called. It's a nasty pathogen. The incubation time is up to 400 days. So imagine it's your daughter or granddaughter, and you take her to the ER, and they say, did you go to the dentist? You might say, no, we haven't been to the dentist in a year, because it could be a year. The average was 90 days. So it's hard to prove causation or linkage, and that's why these cases are probably happening more often. So the way it happened in Anaheim is that Mimi gets sick, another kid gets sick. When it got to be 10 kids, it was on the local news. When it got to be 30 kids, it was on the national news. I saw it on CBS This Morning or Good Morning America. And so you guys might not have seen this story, but it was on the news for a while. And when it got to be 73 kids, healthy kids that got sick from contaminated dental water, when it got to be 73 kids, they shut the website down because there was lawsuits ongoing. And you can go to the next slide, Tiger. I just got off the phone with Dr. Zinman, who is involved in this case, and he said it's been pushed back. They weren't going to. It turned out to be 200 children, 200 families, and 200 lawsuits. They're not going to have 200 lawsuits. They're going to have 4 bellwether trials. They were set for April. But they're not going to have them because of COVID until January 11th of next year is when the first 4 of these trials go to date. You can go to the next couple of slides, Tiger. There, it's just kind of an update.